Hello, my name is Pauline RN. Welcome to my channel. Today we are doing bowel elimination, and this is part 3. Questions and answers are in Nclex examinations. Please hit the like button, please subscribe, please share this video. My first question: what are the uses of an NG tube? The correct answer: decompression. We use NG tubes to remove fluids, gas from the stomach, promote GI comfort, allow surgical wounds, example, abdominal wounds, to heal, provide feeding for patients with malnutrition. Next question: what are the techniques to insert the NG tube? Correct answer: the techniques to insert an NG tube is the clean technique, not sterile. You do require gloves to insert an NG tube. Next question: how would we measure our NG tube for insertion? The correct answer: from the tip of the nostril to the earlobe to the xiphoid process. Before insertion, assess if the patient had an history of nasal surgery, nasal polyp, deviated nasal septum. Ask the patient which nostril he or she prefers the tube to be inserted. Assess patency of the nostril. How do we confirm placement of an NG tube? The correct answer is X-ray is the most reliable source. Next question: when you are inserting an NG tube and your patient is experiencing respiratory distress, what would you do? The correct answer is to stop immediately. Leave the patient and return and reinsert the tube. Make sure the patient is in no distress before you leave the bedside. Next question: how often do we flush our NG tubes? The correct answer is every 4 hours with water. Prevents clogging. We flush it until the water becomes clear. When we flush the NG tubes because sometimes we have to put medications in. Patients are NPO, they cannot swallow pills, so we have to crush pills to insert in the NG tubes and in the gastrostomy tube. So we have to keep flushing them till clear every 4 hours as ordered, and check residuals also. When you administer medications in an NG tube, what is the procedure? The correct answer: before you insert the crushed tablets in the NG tube, turn the suction off. Turn the suction off completely. Insert your medication, your water, flush it till clear. Do not return suction. Keep it off suction for 30 minutes. We do not want the medication to be flushed back into the wall canister. So you're going to disconnect the NG tube from that wall canister suction. After 30 minutes, you come back, then you can restart your NG suction. Next question, when your patient has an NG tube, what is the position for the patient? The correct position for patient with NG tube, gastrostomy tube, is 90 degrees. Elevate the head of the bed, prevents aspiration. NG tube insertion, 90 degrees. Sit the patients up in bed. Next question. I saw here that after you administer medications, you flush with water every 4 hours, and you check residual every 4 hours. Follow your doctor's instructions. If you have a medication that the doctor has ordered and it's an enteric-coated or sustained release medications, you cannot put them down the NG tube. You cannot crush them and place them in the NG tube. Medications that cannot be crushed or given through an NG tube or a G tube, they are not crushable medications. Your enteric-coated and your sustained release, these are long-acting medications. You do not crush them down the NG tube. Notify your pharmacist, notify your doctor. Next question. Patients with NG tube, can you give them mouth care? Yes, is the answer. They're NPO, just don't have them swallowing the water. Next question. Patient is on tube feeding, GI tube, gastrostomy tube. The patient is throwing up. What do you do? The correct answer is you stop the tube feeding. You turn off the tube feeding. You turn the patient to the left side and suction the patient. If the patient is throwing up, stop the feeding. If they're throwing up, this shows us that the patient is not tolerating the feeding. The patients are at risk for aspiration pneumonia. Notify the doctor. Notify the doctor. Next question. Before you administer tube feedings to your patient in a gastrostomy tube, what should you do? What should the nurse do? The correct answer, before you administer tube feeding, check the expiration date. Administer your tube feedings at room temperature. Shake well before administration is the correct answer. Next question. If your patient is getting tube feeding, you check your results 4 hours. You check your residual 4 hours after. And the residual is double the infusion rate. Say the infusion rate is 20 cc's an hour. If your residual is 40 cc, if it's double the infusion rate, what do? The correct answer, you stop the feeding and you notify the doctor. Or if the doctor may give you an instruction, hold the feeding for 1 hour, then return and recheck the residual. But it depends on what your doctor's orders are. But if your patient's residual is double the infusion rate, stop the tube feeding, notify the doctor. Patient's tube feeding, they're throwing up, stop the tube feeding, notify the doctor. Do you know what a barium swallow test is? A barium swallow test, correct answer, I've seen this with my bariatric patients, is a swallow evaluation. Patients will have bariatric surgery the night before. Early in the morning, about 7 o'clock, they will go down to do a swallow evaluation. It's done by x-ray. They x-ray the abdomen and the patient will swallow a contrast. They are evaluating to see if the patient are able to resume a diet. If they pass the swallow test, then they can, postoperatively, the diet can be changed from an NPO diet to a clear liquid diet. But they have to pass the swallow evaluation test first. They have to pass the barium swallow test before they can advance postoperatively from a NPO diet to a clear liquid diet. Next question, why do we use a Sitz Bath? Correct answer is post-op hemorrhoidectomy, rectal incision and drainage post-operatively. We use for postpartum patients, vaginal delivery. Some patients have rectal abscesses. Sitz Bath decreases inflammation. Sitz Bath is done 20 to 30 minutes with warm water. We have to give patients discharge teaching on Sitz Bath before they go home. They will be continuing this home. Next question, what is ulcerative colitis diet? Ulcerative colitis diet, correct answer is low fiber, high protein, iron supplements, and vitamins. Next question, what is signs and symptoms of ulcerative colitis? The correct answer is anorexia, malnutrition, diarrhea, cramping, dehydration, fluid electrolyte imbalance. For these clients, you'll notice they have ileostomies connected to the abdominal wall to eliminate waste. Next question, what is Crohn's disease? Correct answer is an inflammatory disease. It has remission and exacerbation. It has remission and exacerbation. Affects colon, rectum. These patients usually have a colostomy placed. Signs and symptoms of Crohn's disease: abdominal distension, cramping, diarrhea, colicky, pain, and dehydration. Next question. For patients with Crohn's disease, they'll have a colostomy. What is a colostomy? It's a created opening on the abdomen. It's called a stoma. The waste is drawn in a bag instead of the anus. Next question. Postoperatively, colostomy assessment. Correct answer. 2 days after colostomy insertion, there will be passing of gas, but there will not be any output. So don't look for output of stool on the first day. You will not see any stool the first and second day of a colostomy. You will notice by day 2 they will be passing gas. For colostomies, we assess the site, we'll assess the stoma, signs and symptoms of infection. We'll assess passing gas day 2. After evidence, 2 days after, which is evidence that peristalsis has returned. Next question. What is the output of the ileostomy? The output of an ileostomy, correct answer is liquid stools mixed with a little thick liquids. Next question. For colostomy, what is the output? It's soft, thick, brown, slightly formed output. For ileostomy, stools are liquid mixed with a little thick liquid is the output of an ileostomy. Please hit the like button, subscribe, share this video. Thank you. Have a good day.